In this lecture, we will discuss the EKG criteria for biatrial enlargement. Biatrial enlargement is diagnosed when the criteria for both right atrial enlargement and left atrial enlargement are met. This means it could be either in lead 2, lead V1, or a combination of leads. So let's use this lecture as a chance to review both the criteria for right and left atrial enlargement, as well as a chance to see some of these possible combinations. Okay, so what we say here is the biatrial enlargement, okay, equals right atrial enlargement plus left atrial enlargement criteria. Remember, for right atrial enlargement, we're looking for an increase in P wave amplitude, okay? Now, before we even get there, remember, the initial portion of our P wave represents right atrial depolarization, and the terminal portion, left atrial depolarization. We can see the same thing here in V1, okay, where we see that biphasic P wave. Here's the right atrium being depolarized and the left atrium being depolarized, okay? And the V1 is a great lead. It represents the short axis view of the heart, especially the atria, so we can see problems on here with the right atrium and on the right side with the left atrium. Okay, so now back to right atrial enlargement, we're seeing an increase in P wave amplitude, and we need at least one of the following, okay? In lead 2, we want a P wave amplitude greater than or equal to 2.5 millimeters, okay, or 2.5 small boxes. Okay, so here's the criteria, and you can certainly see that, okay? Notice that here's almost 1, 2, 3, almost 4 small boxes, okay? So we meet it there, and again, that's what we call P pulmonale, okay? And you can think of this right atrial enlargement and P pulmonale because most of the causes tend to be due with the lungs or the pulmonary system, right, as a result of pulmonary hypertension. Now, the other criteria we said was with the initial positive P wave deflection in lead V1, okay? Here's V1, and remember the initial P wave, okay, is this portion here, and notice that it has to be at least 1.5 millimeters in amplitude, and it's certainly that case here. Okay, so we need that criteria, and then we need one of these left atrial enlargements. So let's go through this criteria here for that. Again, with left atrial enlargement, we're looking for an increase in P wave duration or an increase in the depth of it. Now with lead 2, we can have P mitrale, which we said is notching of the P wave, okay, where it looks like that M-shaped as we see here. So imagine that notching of that P wave. Then we said that the duration, the total duration of the P wave needs to be 100, greater than 110 milliseconds, so it's prolonged. And we said this notching between those peaks have to be greater than or equal to 40 milliseconds, which is one small box, okay? So that's what we call that P mitrale. Remember, mitrale is a good way to remember that mitral stenosis is commonly a cause of it, okay? As well as that M-shaped P wave that we saw here. Okay, so that's lead 2 and lead V1. In our biphasic P wave, we're looking at the terminal negative deflection, and in that case, we're looking at the end. So if we draw this here, the terminal portion should be at least 1 millimeter deep and 1 millimeter wide. Okay, remember that equation where we're looking at the depth in millimeters, and it will be negative because we're going down or below the baseline, okay? And then the duration, which should be in seconds, okay? So multiply the duration. If you get that, multiply those, it should be greater than negative 0.04 millimeter seconds. Okay, so that's the criteria for both right and left atrial enlargement. And what we're saying here is that in order to make the criteria for biatrial enlargement met, we need to meet both of those criteria. Okay, in other words, we can have this P pulmonale with P mitrale, okay, or we can have this P pulmonale with these changes seen in the terminal portion of V1, okay, for left atrial enlargement, or we can have the P wave changes seen here in V1, the initial portion, as well as in the terminal portion, or we can have it where we see the initial changes in V1, okay, for right atrial enlargement, and then the changes of P mitrale in lead 2. Okay, so a bunch of combinations. You just need one of each met to meet the criteria for biatrial enlargement. So hopefully this is all starting to make sense and starting to come together. Now note that some resources may suggest looking at other leads, such as all the limb leads, but the leads 2 and V1 are often the best leads to look for atrial abnormalities. Anyways, keep reviewing the criteria for atrial enlargement, and soon it will become second nature. Well, that's the end of this lecture. We discussed the EKG criteria for biatrial enlargement. I hope you learned something.